Okay, so we want to talk about the distal convoluted tubule and the collecting duct. Okay, now one thing that's important for these is to realize that they're under hormonal control. So out of all of the things in the kidney, so the PCT and the nephron loop, the only part where there are receptors for the hormones are the DCT and the collecting duct. So the hormones that we're going to talk about are only going to work on this part. Okay, they're going to work. There's two kinds of cells that are only found in the DCT and the collecting duct. And those are principal cells. Okay, so principal cells have receptors for hormones. So they're going to help change water and salt balance. Okay, and then we have intercalated cells. Okay, now these cells are going to be involved in acid-base balance. Okay, so they're just integrated within the DCT and the collecting duct. Okay, now these cells are going to reabsorb potassium. Okay, they're going to secrete hydrogen ions. Okay, so they're all about acid-base balance, and that's, I think, the next chapter, or in 2 more chapters, we're going to talk about all that. Okay, now, when the filtrate gets to the DCT, it still has too much water and too much salt. So if you peed what came out of the DCT, you'd still be urinating 36 liters of urine a day. Okay, so the collecting duct has to pick up, or it has to have water get reabsorbed and ions get reabsorbed. Okay, so there's too much of this when we're entering the collecting duct. Okay, so the hormones are next. Okay, so we've already talked about angiotensin and renin. Okay, so when the blood pressure goes down, okay, the kidneys release renin, okay, and it's going to form angiotensin 2. Now, we're going to go off to a different route, okay? So, angiotensin 2, we know it goes to angiotensin 1, and then it's going to be a vasoconstrictor. Okay, now, angiotensin 2 also stimulates the adrenal cortex to release aldosterone. Okay, now, aldosterone is known as the salt retaining hormone. Okay, so it's going to hold on to sodium. And if you look in here, I always say you can see SOD, you can see sodium in there. Okay, so it's the salt retaining hormone. So what it's going to do, okay, so its stimulus is either angiotensin 2, okay, a decrease in sodium, or an increase in potassium. Okay, so the receptor and the control center are the adrenal cortex. Okay, the effector is going to be aldosterone. Okay, and what it's going to do is it's going to, and I'm running out of room, so the result will be we're going to increase sodium. Water's going to follow sodium. It's going to increase water retention. Okay, that's going to increase our blood volume. Okay, and that'll help maintain our blood pressure. Okay, and then potassium will go down. Now, the next one. Okay, anti-diuretic hormone is ADH. So, anti-diuretic hormone. Okay, so the stimulus for it is dehydration. Okay, so dehydration means that we could have, okay, so let's just go down here, stimulus. So if you're dehydrated, essentially, you have a low blood pressure, and you have a high osmolarity of the blood. Okay, now, this is one of those posterior pituitary hormones. Okay, so the receptor is the hypothalamus. It controls the posterior pituitary. Okay, so the posterior pituitary is going to cause the release of the effector, which is anti-diuretic hormone, ADH. Okay, now, what anti-diuretic hormone does is it works on the DCT and the collecting duct. And basically, it triggers the genome to insert these pores that are called aquaporins. Okay, so it inserts aquaporins. Okay, so if we make more of those, okay, we're going to reabsorb more water. Okay, so urine will go down. Urine volume will go down, but blood pressure will go up. Okay, now this one is one of the hormones that has nothing to do with sodium. Most of them have something to do with sodium. So let's put a little no sodium in this one. Okay, so it's got nothing to do with sodium. Okay, now atrial natriuretic peptide or atrial natriuretic factor, they use, it depends on whose book you're reading as to what name they use. Okay, so it's released when blood pressure goes down. Okay, so decrease in blood pressure stimulates the right atrium to secrete atrial natriuretic peptide or factor. Okay, now what it's going to do, so let's go through and I will write it all out. Okay, so the stimulus is a decrease in blood pressure. Okay, now the receptors that detect it, what detects stretch? Okay, so baroreceptors detect stretch. Okay, so baroreceptors in right atrium, okay, they're going to detect the decrease, well, an increase in, no, it's going down, right? The stimulus is an increase. Oh, jeez. Increase blood pressure. I did it backwards. This is the opposite. This one does the opposite of everything else. So opposing effects. Okay, so increase in blood pressure. So baroreceptors detect the increase in stretch. The right atrium is the control center. Okay, and it releases the effector, which is the hormone. So it releases A and F. Okay, and then what's going to happen? I mean, we want it, the goal was to get the blood pressure to go down, right? So what's going to happen is we're going to inhibit sodium reabsorption. Okay, so that means that will inhibit water reabsorption. Okay, so that means that you're going to increase urine output. Okay, and that's going to have the opposite effect, so that'll decrease your blood pressure, is the result. Okay, so what you should know about this one, what makes it different, is it's the opposite of renin, antidiuretic hormone, and aldosterone. Okay, so this is the opposite. Okay, now here is a very nice picture that describes what's happening over the whole process. So it summarizes pretty much all of it. So it's showing you most of the reabsorption is going on in the PCT, okay, but we have some secretion, okay, and then we have what's going on in the nephron loop, and then what's going on out here. And you have to remember, this is what's under hormonal control.